It's always a pleasure to visit Columbus Public Health, one of the best public health departments in all of America, under the leadership of Dr. Roberts and her outstanding team, for working tirelessly around the clock to protect and improve the health and well-being of this community. And to all of our healthcare providers and first responders who are on the front lines and making incredible sacrifices each and every day, including the doctors represented here, Joseph Castaldo from Ohio Health, Nicholas Kritsulis from Mount Carmel, Dr. Rustin Morse from Nationwide Children's Hospital, Dr. Andy Thomas from the Wexner Medical Center. I'd also like to thank everyone in Columbus and Franklin County and Central Ohio who has already been vaccinated against COVID-19. We've made extraordinary advances toward protecting people against this virus, and the vaccine is chief among them. Through collaboration and scientific discovery, we have gained powerful new tools and knowledge that are saving lives and preventing or dramatically reducing the likelihood of new or serious infections. Numerous locations across the community are standing by to administer the vaccine to those who haven't received one or completed this series that they have started. It remains our best defense, and I'm asking those who haven't been vaccinated to do so today. Visit the Columbus Public Health website for information on where to get yours. Sadly, however, far too many remain unvaccinated, both here in Columbus and throughout the nation. Without a sufficiently high vaccination rate to stop the virus in its tracks, it continues to linger, evolve, and assume more contagious and potentially more dangerous variations. New cases are on the rise, hospitalizations are on the rise, and the strain on our medical and public health professionals has reached a breaking point. At the beginning of the pandemic, we were very concerned that we did not have enough beds in hospitals to admit every patient. Now, our challenge is not having enough hospital and healthcare workers to keep up with the influx of new patients. 19 months on the front lines of a crippling public health crisis is more than most of us could ever bear. And for some, they have understandably decided to move on. Burnout has taken its toll, and we don't have the number of frontline healthcare workers needed to keep up with the growing demand for their talents and expertise. We have to do more. It's not enough for us to thank our public health and healthcare workers, to put out hashtags and attaboys. We need to get vaccinated, and we need to wear our masks. That's how we show support for our healthcare professionals and public health workers. We also need to do more as a city, and I'm announcing my plans to issue an executive order requiring all individuals, regardless of vaccination status, to wear face masks in indoor public spaces. This isn't about shutting down and giving up. All of us have three goals that we all share in common: keeping our schools open, keeping our economy open, and making sure that our healthcare workers are not overwhelmed so they can do what they do best: help to treat and take care of our neighbors. Regardless of your political persuasion, your beliefs in the vaccine, all of us share the same three principles: keep our economy open, our schools open, and let our healthcare professionals do their jobs and take care of our neighbors. This is about keeping Columbus safe and open for business by employing a strategy we know can slow the spread of COVID-19. This is about providing urgent relief to our dedicated healthcare professionals who have given so much to so many people. And this is about ensuring that if you need emergency medical care, for COVID-19 or another injury or illness, there's a doctor, a nurse, a specialist, a qualified and experienced caretaker available to administer your treatment. We will release additional details on the executive order in the coming days, and I will be working with Columbus City Council to codify this order in the form of an ordinance when they return next week. But nothing about it will prove surprising or unfamiliar. We've done this before. Many of the same caveats and exemptions have previously come to know will continue to apply. Like I said, Columbus is open for business. Our schools are open. Our healthcare professionals are at their breaking point, and we need to step up to do more for our neighbors in crisis. We need to mask up, band together, and bring down the number of infections and hospitalizations. We cannot be discouraged or deterred. We're taking full advantage of knowledge and resources that are safe, effective, and accessible. Knowledge and resources that didn't exist 18 months ago. Knowledge and resources that enable us to see and do the things we enjoy. We will continue to follow the science, take into account new or changing evidence and circumstances, and heed the expertise of our exemplary public health leaders to maximize our collective impact and save as many lives as possible. And now, to tell you a little bit more about our work moving forward, please welcome our Health Commissioner, Dr. Mysheika Roberts.
Thank you, Mayor Ginther, and good afternoon to everyone. After almost 19 months of our fight against COVID-19, we once again find ourselves at a critical moment in this pandemic due to the Delta variant. This extremely contagious virus is spreading like wildfire here in our community and across our state as well as our country. Despite our very best efforts since the beginning of this crisis, the situation is worsening. Our case numbers are up, and they have been increasing since July. Just last week alone, there were 2,500 cases in our community, a 37% increase over the previous week. Our positivity rate is up and is now at 9.6%. It's been increasing since July, when it was right under 2%. And it's almost as close as it was to November of 2020, before we had a vaccine. Our case rate is also increasing. We are now seeing a 14-day aggregate case rate right here in Franklin County of 408 cases per 100,000, which is also similar to the rate we had last November. Now, even though that rate is high, there are counties in Ohio that have rates higher than that. So let that sink in for a second. What this all means is a significant strain to public health in our hospital systems. It's worsening. The virus is spreading in our community, and we must do something. We must do everything we know to do now to stop it. It will take all of us to protect our community, and most importantly, to protect our kids. And there are some very simple public health interventions that we know can help slow the spread of this virus. You heard the mayor say them. First, we can all get vaccinated. If you know someone who's not vaccinated, please encourage them to get vaccinated. It might take you altering your activities you do with them to show how serious you are about that. And strongly encourage them to get vaccinated. Vaccines are safe, they're effective, and they can be found in almost any retail pharmacy and any health department here in our community. Currently, 53% of Franklin County residents are fully vaccinated. But if you just look at Columbus residents alone, only 46% of Columbus residents are fully vaccinated. We need more people to roll up their sleeves and get this vaccine, not only for themselves, but for our community. Last week, 26.5%, almost a quarter of our new cases were under the age of 18. If we compare that to a year ago, it was 4.4%. And then if we look at just those kids who are not eligible for the vaccine yet, so those who are 11 and younger, they represent 15.5% of our newly reported cases. A year ago, they represented less than 2% of our new cases. In fact, just this week, Dr. Morris of Nationwide Children's Hospital joined over other chief medical officers of children's hospitals across the state to urge people to get vaccinated. The people we trust to take care of our children when they need it need your help now. We must protect the children in our community by getting vaccinated so they can stay healthy and safe, but most importantly, they can stay in the classroom, which we all know is where they need to be. Second, wear a mask. Whether you're vaccinated or not, we need you to wear a mask. Masks are a simple way to protect yourselves and others, and I am so grateful for the mayor's executive order on masks, which will help ensure that this simple public health measure is in place when people go indoors. It's important to remember that there are people with COVID who never get sick. They never have any symptoms. They would never know they were sick, nor the people spending time with them. They might have very mild symptoms and just think it's allergies or they didn't get enough sleep. But they can be spreading this virus to others, even though they're vaccinated. And then we know there are people in our community that are high risk for complication, whether they have underlying health conditions, whether it's because of their age, and we want to keep them healthy and safe too. So that's why we wear our mask. In addition to the vaccine, in addition to the face coverings, those are some of the best tools we have to combat this pandemic. So we have to do everything we can as a community to work together, to band together, to make sure we keep our economy going, we keep our kids in school, and we keep our hospitals open and available for those unexpected health issues like heart attacks and strokes. And third, we should be very mindful about avoiding large gatherings, especially when they're inside. And then when they are inside, we're all going to be wearing a mask now, so that's the important thing. Finally, whenever you can, you should maintain social distancing, just like we're doing here on stage today, trying to stay at least 6 feet apart, but if you have that mask on, we can get down to 3 feet apart. The bottom line is we have to use every tool we have in the toolbox to help us combat this pandemic. We know what they are. Get vaccinated, wear a mask, avoid those large gatherings, especially indoors. And so I want you to hear from our hospitals and what they're experiencing. So I'm going to invite Dr. Andrew Thomas, the Chief Medical Officer at OSU Wexner Medical Center, and also our Zone 2 lead, to tell you a little bit about what our hospitals are experiencing. Thank you.
Good afternoon. I'm here today to give an update on our COVID inpatient hospital census for Zone 2. That represents over 40 hospitals and health systems across 37 counties in Central Ohio, South Central Ohio, and Southeastern Ohio. The leaders of our local hospitals have been highlighting this issue for the past few weeks, but simply our COVID numbers continue to grow quickly. Our highest day for the active COVID inpatient census for our zone was back in December of 2020 at 1,200 patients. Just over 10 days ago, on Sunday the 29th of August, we crossed 600 patients with active COVID in the hospital in our zone. On Wednesday, September 1st, we crossed 700 patients. On Monday, September 6th, Labor Day, we crossed 800 patients. And today, we've crossed 900 patients. So that's a change from August 1st of 150 patients in our zone in the hospital with COVID, and now we are over 900, a 6-fold increase just since August 1st. Similarly, the proportion of hospitalized patients who have COVID has grown substantially. 1 in 6 patients in the zone in a hospital for any reason are there because they have COVID. On August 1st, it was 1 in 31. 1 out of every 4 patients in an ICU in Zone 2 is there because they have COVID. On August 1st, it was 1 in 17. And today, 1 in 3 patients on a ventilator in Zone 2 for any reason have COVID. On August 1st, it was 1 in 10. As of this week, we've increased our zone surge calls to 5 days a week. And the tone of voice I'm hearing from our regional hospital leaders that I connect with on a routine basis is more than just anxious. It's more than just concerned. No one's in a panic. Our healthcare leaders don't panic. We partner. We partner to move patients between hospitals when we have to. We partner to move supplies and medications between hospitals when we have to. And we partner to move ventilators when we have to. But partnerships within the healthcare sector are simply not enough. Without the partnership of employers, school districts, colleges and universities, faith-based organizations, community leaders, parents, frankly, all members of our community, things are only going to get worse. The reality is that COVID patients in our area are now crowding out patients needing care for other reasons. On today's surge call, we had multiple hospitals in the zone describe having patients boarding in their emergency departments, too sick to go home, and waiting for a non-existent inpatient bed in the hospital. Some hospitals have already started postponing necessary surgeries, procedures, and other routine care because they simply don't have the staff or the space to do it all. Until we start to see new COVID cases plateauing and coming down, we expect hospitalizations to continue to increase, and these trends are simply not sustainable. Thank you. I'll turn things back to the mayor.
Thank you to Dr. Thomas, and thank you to all of these outstanding healthcare professionals and their teams at their respective health systems and at the Department of Public Health. Although we are still in the earliest days of this pandemic's latest chapter, I know that you will all mask up to protect our neighbors. You did it before. We can do it again. I also know that this is not ideal. I get it. I relished for several weeks the ability to move out and about once I was vaccinated without a mask. But we're in a different place. And what Dr. Thomas and Dr. Roberts and their colleagues have shared with us is that we're at a critical place battling this pandemic in this community. We all need to step up and do our part to protect ourselves and our neighbors, and continue to reinforce to everyone in this community, those that have been vaccinated and those that have not. If we're all committed to keeping schools open and kids in the classroom, keeping our economy open, and allowing our healthcare professionals to treat our neighbors in need, we have to get vaccinated and we have to wear our masks. We know, based on our history and work together, we can do this. We've done it before. The sooner we take action and the more of us who do, the greater and more immediate our impact will be. Be happy to take any questions, or if there are questions for the doctors behind me. Luann?
If you could just walk us through that executive order, what the plan is and how council has to weigh in on it, and kind of following that, how will we enforce that mask mandate?
It'll be very similar to the order and the legislation that was passed, that I issued and that was passed earlier in the year. Same sort of caveats and exemptions for particular groups, obviously, ones that make sense. So it'll be very similar to that. There won't be much change at all. We'll have a copy of it. It's being reviewed by the city attorney's office right now, and we'll share that within the next day or two with the public when that's signed. As far as enforcement, I'll let Dr. Roberts speak a little bit to that. I think it will be complaint-based, and those investigations and enforcement will be done in partnership with public health if the legislation that we're asking council to consider on Monday mirrors what they passed before. Dr. Roberts?
To be clear, the council has to pass it first before it goes into effect.
No, the executive order, once I sign that on Friday, it will go into effect. I've asked council to take legislative action on Monday as well. We believe that that will send the strongest message that you have both the executive branch and the legislative branch taking action. And my guess is there might very well people be people out there that are looking to challenge it. And based on the advice and counsel of the city attorney, having both executive and legislative action take place, putting this measure in place, this mask requirement, gives us the best chance of that holding up. Dr. Roberts?
In terms of enforcement, once the legislation is passed, Columbus Public Health will enforce it just like we did previously. Our sanitarians will go out. It'll be complaint driven. So as we get complaints that come into 311, we will follow up with those complaints. There'll be a penalty. First there'll be a warning, then there'll be a $500 fine, and then there'll be an $1,000 fine for the third offense. Yes.
In addition to the executive order, the incentive giving, the $100 incentive giving for vaccination will end by Friday. Is it going to be extended?
So I couldn't hear you completely. I think you're asking about the executive order. It's my understanding the mayor will sign it by the end of this week.
I'm talking about the vaccination incentive.
Oh, sorry, the incentives. Okay. Yeah, sorry. Thank you. That's a great question. So, yes, our $100 Vax Cash Card incentive program is set to expire this Friday. It will likely be extended. We will be announcing that shortly. If it is extended, we will likely have to scale back how many locations we can provide that Vax Cash Card because of our staffing issues. And as many of you know, and some of you might not know, next week is Exclusion Week for Columbus City Schools, which means all of our kids have to have their vaccines in order to stay in school. And so we have all hands on deck to make sure our kids are vaccinated to stay in school. So that will limit the staff we have available to go out to more of our community sites over the next few weeks. But our intention is to extend Vax for Cash Card as long as supplies remain.
Are children eligible for that?
Anyone who is eligible for the vaccine is eligible for the $100 gift card. So 12 and up, you are eligible for the $100 gift card. Yes.
Doc, you want to share some of the statistics?
Sure. So the mayor asked me to share some of our statistics about our Vax for Cash Card campaign. We've given out over 13,000 Vax for Cash cards. I believe as of Friday evening, it was 13,600. We're vaccinating about 300 to sometimes 500 a day with that program. As you know, we're offering it here Monday through Friday, and we go to different community sites, rec centers, and community-based organizations to provide those vaccines. It's been very well received by the community. We have appreciated getting more people in our community vaccinated. And again, while supplies last, we will continue that program to get more people vaccinated. And it's been a model. Others across the state have started to use it as well.
Mayor Ginther, 18 months into this, what does it feel like to be back in a position where you're issuing another executive order on masks from a public health administrative perspective?
I'll let the mayor go first since you talked about the executive order.
Well, I think if you and I are tired, think about the nurses and the doctors and the public health workers, the colleagues of Dr. Roberts. And we've spoken about the toll this has taken on our healthcare community. We used to talk about beds, now we're talking about people, the ability to care for our neighbors who are in crisis and need that acute care. I tell you what, I'm inspired by the number of folks who have stepped up, raised their hand, and gotten their vaccination. I'm inspired by the set of scientists and the medical providers that gave us the greatest tool to fight a pandemic, the likes of which we have not seen for over 100 years. They've given us that power. They have put the vaccine in our hands. So there's really only one thing we need to do. Well, actually two if you're not vaccinated. But if you're vaccinated, wear a mask. That's all we're asking. That's the only sacrifice we're asking people to make, is to wear a mask. And if you haven't gotten vaccinated, get vaccinated and wear your mask. We can do this. We've done it before. We know the path forward. Follow the science. Keep our economy open. Keep our kids in school. And let our healthcare professionals treat and care for our neighbors. We can do this. Doc?
I'll be honest with you, Eric. It's very frustrating. In some ways, I feel like I failed my staff. Back in March of 2020, I had my staff all hands on deck to respond to this pandemic, and they did that for the good part of a year. We put many of our programs aside, and just about April and May of this year, they got to go back to some of their regular duties. And if I could take pictures of their faces when I told them I needed them to go back to responding to this pandemic, I really felt like I let them down. And I think the most frustrating part for me is I don't know when to tell them it's going to be over. I wish I could say, let's just get through this year, let's get through Christmas, and things will get better. But I don't have the answer to that. And I think that's what's frustrating them more. And I think you're going to find that same thing with our hospital workers, is when will this end? They just don't see an end in sight for them. I mean, for you all and for most people, it's about going about your life and having, some issues because you have to wear a mask, or you're frustrated because some people aren't getting vaccinated. But for them, that's their life, and then they have to come to work and deal with it at the same time. So it's a double whammy for those of us in public health and in healthcare.
Any other perspectives from health systems
Good afternoon. Well, I could tell you at Ohio Health, people are tired. For the last year and a half, me personally, I've been doing nothing but COVID. And it's still going on. The virus is still here. We have the tools to end the pandemic, and the pandemic ends through immunity, through vaccinations. But like I said before, we are all tired in healthcare, and we are really asking everybody in the community to step up, wear a mask, and to get vaccinated. We have 3 safe and effective vaccines, and the pathway, again, is to wear a mask and get vaccinated.
Kind of twofold questions here. First, about breakthrough cases. I think the figure was like 1 in 10,000. Now it's closer to 1 in 5,000. How do those numbers jive with the city of Columbus? What are you guys seeing with breakthrough cases? And then if Nationwide Children's can talk about what they're seeing in their hospitals, that'd be great as well.
Sure. Well, I'll talk a little bit about breakthrough cases. I think most of you know that is not something that's reported to us. Dr. Gustavo might be able to give a little more information on that, and then I'll definitely have Dr. Morris talk about what they're seeing at Nationwide Children's Hospital.
So again, breakthrough infections are uncommon. This virus is more likely to infect somebody who is not vaccinated compared to somebody who is vaccinated. However, when it comes to protection from severe outcomes, whether it be hospitalizations or deaths, the vaccine still performs very well. At Ohio Health, we roughly have 15 to 20% of our hospitalizations with COVID being in those who are fully vaccinated. But when you look individually at those patients, there's a common denominator they have. Many of them are immunocompromised, many of them are elderly. Those are the types of people where the vaccines don't work as well. So again, breakthrough infections are uncommon. Infections are clearly more likely in people who are not vaccinated. But the vaccines are still performing very well with what matters the most, preventing severe outcomes from COVID-19.
Good afternoon. So I'll speak about Nationwide Children's and pediatrics in general, because it really is a broader issue than just the hospital. So this surge is different this time for us from a pediatric perspective. We are seeing, at the same time, a Delta surge from COVID. We're having unprecedented winter viruses, specifically respiratory syncytial virus, or RSV, surging at the same time. That's a virus that we typically see in the middle of winter, not here in late summer, early fall. So the pediatric practices, as well as the hospital, are really quite overrun with patients, sick children, both from COVID symptoms as well as respiratory syncytial virus, and the common other illnesses that children just get, especially as they return to school. Which is why it is so critically important that if you're eligible to be vaccinated, you get vaccinated, and why it's important to mask up, especially in schools, if we want to keep our children in school this academic year. So at the hospital specifically, our emergency departments and urgent care centers are seeing record volumes that are higher than we typically see during a busy winter season. season, excuse me. And last year earlier in the pandemic with COVID, I would say repeatedly, this is not really impacting children the same way from a health perspective. It's impacting them from a school perspective and a behavioral health perspective. Now we have to add in, it is impacting them from a health perspective. We currently have 25 children admitted at Nationwide Children's Hospital. 22 of those, so 88%, are symptomatic with COVID, meaning they're there because they have COVID symptoms. 10 of those are in the intensive care unit. 5 of those children, as of this morning, have breathing tubes in their throat breathing for them. So this is a significant and severe illness for children now in a fashion that it was never like it before. So we're seeing that. We have 9 children in the hospital who are of age to be vaccinated and are symptomatic. None of those 9 children are vaccinated. We know that the vaccine is helpful against keeping children and adults out of the hospital and out of the intensive care unit. So we have 9 children who are of the age to be vaccinated, none of whom are vaccinated, and they're all symptomatic in our hospital. My ask to the parents in the community, besides encouraging your children to wear their masks in school, is if your child needs to be tested because they were exposed to COVID from a school and their school is insisting that they be tested for COVID, do not come to the emergency department or our urgent cares for testing. Go to the Ohio Department of Health or Columbus Public Health websites and get tested externally or contact your pediatrician. We do not have the capacity to have children showing up who are asymptomatic coming in just to be tested for COVID. As the mayor and others have stated, our staff are tired. They're working tirelessly to help take care of all the children who are coming to the hospital that need to have care. And frankly, the volumes are almost overwhelming in the emergency department and in the urgent care centers. So we need to keep those who are just coming in for asymptomatic testing out of the emergency department and out of the urgent care.
I'm wondering if could you provide an update on Ohio Health's postponement of elective surgeries? And then maybe for Dr. Thomas, if you're aware of any other hospitals in central Ohio that are facing that same struggle.
I want to make sure I heard the question. I think you wanted me to comment on Ohio Health's pausing on elective cases. Yeah, so I think it's the clear message is in the hospital, we're trying to walk and chew gum at the same time. We're taking care of COVID patients. We're still catching up for people who have delayed their care, whether it be for hip replacement, mammography, or colonoscopy. So at Ohio Health, each hospital, each care site is making decisions on their own on which types of surgeries or procedures they need to de-escalate or reschedule. And what's happening, for example, at Grant is different than Doctors Hospital, which is different than Riverside Methodist Hospital. But each hospital is determining what they can do based on the capacity of COVID patients, non-COVID patients, and more importantly, the staffing constraints that we're dealing with.
I believe your question was about the other hospitals in the zone. I would say on today's call, about a third of the hospitals were in some phase of either going day to day, assessing what surgeries could be delayed safely. But I think every hospital is realizing that at some point, if the numbers continue, they need to be assessing the situation and potentially making those difficult decisions.
Luann, that's a great question. And obviously, let's state the facts. Getting COVID indoors is very much a riskier proposition than getting it outdoors. Outdoors can be events where the virus is spread, where people are not wearing their masks and when people cannot physically distance. And yes, there are concerns with outdoor crowded events being areas where people can spread the virus. I'm going to turf a little bit for comments to Dr. Thomas from Ohio State for further responding to that question.
I'm not going to do that. Okay. I'm not going to do that to Dr. Thomas. So I will tell you that I believe OSU has done everything they can do to try to make that game as safe as possible. You know, over the summer they had tailgating events at outlying communities to try to encourage more vaccination among their fan base. They also have a mask policy in place that they announced just a few days ago. We have been working with them at Columbus Public Health to try to put everything they can possibly put in place. And I will also say, you know, that here in the state of Ohio, they are consistent with all other football games and outdoor sporting events that we have across the state. And so I commend them for what they're doing. I actually think they're doing more than some of our professional teams are doing. They're encouraging mask wearing outside in the stadium, and they're mandating masks inside. And so people understand what the risk is of going to that type of event and have chosen to partake in that, as well as many other outdoor events we have across town.
Overwhelmed, our healthcare workers are overwhelmed, and 100,000 people are going to sit like this in a game. Isn't that going to be a super spreader?
Again, as Dr. Costado said, we know outside is better than inside. And with the precautions and the different things that OSU has put in place, and I'm hoping after many hear this message today from all of us, they will choose to attend the game accordingly, behave accordingly, wear a mask, make sure they stay home if they're sick, and get vaccinated as soon as possible if they're not. I think that I only have one more question that we can entertain.
Apply to gyms and fitness.
Will the mask mandate apply to gyms and fitness facilities? Just like before, it will, as long as you're not partaking in strenuous activity, strenuous exercise, you would be expected to wear a mask. So what does that mean? As you walk into a gym, you'd be expected to wear a mask. As you're on a machine or as you're actively lifting weights, you would not be expected to wear a mask, but walking in and out, you would, and even moving from one machine to another, you would be expected to wear a mask.
Dr. Thomas, obviously hospital burnout and stress was a big topic of discussion here today. Do we have figures in the Central Ohio hospitals how many healthcare workers have left because of the burnout in the past?
I don't know. They're asking, does anyone have figures of how many healthcare workers have left?
I don't have figures, but I know it's definitely when we hear from hospitals all around the region, people are down a substantial number, obviously, depending on the size of the hospital. But some of that is natural attrition. Some of that is people that, as Mayor Ginther described, that were maybe towards the end of their career, and this has just been too taxing for them. And then other people have just made personal decisions for a lot of very good personal reasons. So maybe their own health was a concern. So it's definitely a significant number at a hospital the size of one of our hospitals in Central Ohio. It would be along the lines of hundreds of people.
The only thing I would add, because we focused on the stadium and 100,000 folks there. There are 100,000 folks that gather in that stadium. There are several other 100,000 folks that gather throughout this community in bars and restaurants and home parties and want to focus on that just as much. We want folks wearing their masks at the game on Saturday and large gatherings into the future where they can't maintain social distancing. But we also need Buckeye fans to rally together that aren't in the shoe on Saturday, but cheering on from their living rooms or their favorite restaurant or neighborhood watering hole. We need them to take the same sort of precautions to protect one another. And ultimately, at the end of the day, making sure that we're able to continue to enjoy Buckeye football throughout the fall. We need to keep those student athletes healthy. President Johnson's been a great leader. She's a scientist. She's been following the science and has been, I think, very courageous in things that she's laid out, expectations, the mandates they put in place, and she has continued to consult. She and athletic director have continued to consult with public health. We're confident if Buckeye fans show up, are masked up, that we can make sure that that's a healthy event on Saturday. I think based on everything we've seen from Ohio State, the way that the students and the allies, alums, supporters of Ohio State have responded, I'm very confident that we're going to have a safe event on Saturday. As long as folks mask up, and do their part to keep everybody safe. Thanks, everybody.